Hi, I'm Sean Harrison, the founder and CEO of Paired Health, and we are reinventing house calls. We're building a cloud service that seamlessly connects hospitals and health systems with their patients to deliver efficient physician care at home. Think about it, taking the hospital to the home. This approach is critically important for transitional care, but also applies to convenience lines of business like urgent care. Here's why our business makes such good sense right now. Healthcare cost and quality problems are actually pretty concentrated. For example, 5% of the population drives about half of the cost. And with Medicare, 15% of the population drives 75% of the spending. That's 15% of $600 billion, a sizable chunk of which can be attributed to patients being readmitted to the hospital within a month after leaving. And that's the rub for our clients, the hospitals and the health systems. Since they're penalized by Medicare for unnecessary readmissions, hospital leaders have a huge incentive to extend their care for patients away from the hospital to where they can be cared for more cost effectively. So our patients, picture Aunt Edna in your mind, are often frail and have multiple complex conditions that are extremely tough to treat. When in the hospital, Aunt Edna gets great care. But when she goes home, though she may get a visit from a home health nurse, she may quickly fall off the cliff and bounce right back to the hospital. About 20%, 1 in 5 Medicare patients readmit within 30 days of being discharged from the hospital. While iPhone, iPad, Android apps for automated patient reminders or Bluetooth connected diagnostic tools are fantastic and can help, sick and vulnerable patients like Aunt Edna, they need more than that. They need the touch of a skilled provider in the comfort and convenience of their home. That's where Paired Health enters the picture. We equip health systems with cloud computing tools to extend patient care beyond the 4 walls of the hospital and into the home. Our cloud services incorporate 3 key functions. Number 1, physician logistic tools. Think about FedEx route optimization technology, but instead of moving packages and trucks, we're moving doctors. 2, think about patient scheduling tools, something like Uber or OpenTable, but instead of requesting a black car on Market Street or dinner for 2 at Alexander's, we're enabling hospitals to schedule real-time transitional care, home visits with frail patients that need that follow-up physician care. We're also enabling patients to request mobile at-home urgent care. 3, care plan tools. Think about Epic EHR, but instead of medical records and decision-making functions being limited to care in the hospital, we're extending the intervention protocol to include care at home over a 7, 14, or even 30-day period based on the individual patient need and evidence-based standards. Our platform is entirely cloud-based and built on top of Force.com and Amazon Web Services. We don't manage our own servers or require our health system and hospital partners to install any software. All functions are web-based and HIPAA compliant. And by the way, we're doing this today with our first health system in the Research Triangle Park, North Carolina area, and we're achieving excellent results. How good? How about 5% 30-day readmission rates compared to a 20% baseline? So, in summary, outstanding care for the most challenging patients, multi-billion-dollar transitional care opportunity, 100% cloud computing platform to systematically and efficiently deliver care to the most challenging patients. And on top of all that, we have a fleet of Paired Health Priuses. And as it says, we are driven to deliver smarter care.